Did you know that simple nutritional deficiencies of basic vitamins can cause permanent brain damage and nerve injury? In the case of vitamin B12, also known as cobalamin, prolonged deficiency for only 6 months can lead to permanent brain damage due to accumulation of toxic intermediates, including methylmalonic acid.
2 ways for you to ensure that this does not affect you are: 1. Supplement with 2,000 micrograms of vitamin B12 in the form of hydroxycobalamin every day. And 2. Get the blood test for methylmalonic acid every few years in order to make sure that your diet and supplement program are covering all the bases.
Of course, you should get other tests such as for vitamin D deficiency at the same time, just to make sure you are minimizing your risk for preventable problems such as dementia, depression, and diseases like cancer and autoimmunity. Test your vitamin D level by measuring 25-hydroxyvitamin D3 and making sure that the level is at least 50 nanograms per milliliter, which might also be reported as 125 nanomoles per liter. Thanks for watching this video, and follow for more at healthythinking.substack.com.
So let's take a look at depression and behavior and mood disorders as a manifestation of a problem or imbalance within the brain, not necessarily a medical diagnosis. So here we're about to focus in on biological plausibility, and this will help you kind of have some framework and language to explain how vitamin D can actually affect brain function. So again, let's answer that question. How could vitamin D deficiency manifest as brain or mood disorders? Number 1, the nuclear vitamin D receptor modulates 3,000 genes, any one of which could affect mood and behavior. The membrane vitamin D receptor also modulates rapid responses at the level of the cell membrane, and that affects certain second messengers, which also have effects on nervous tissue physiology, therefore brain function, therefore mood, and therefore ultimately behavior. The so-called active form of vitamin D, calcitriol, activates the transcription of the serotonin synthesizing gene, tryptophan hydroxylase 2. Vitamin D also downregulates NF-kappa B, which is a major pro-inflammatory transcription factor, therefore reducing systemic inflammation, therefore also reducing glial activation within the brain. Enhanced calcium absorption should reduce parathyroid hormone levels to reduce intracellular calcium levels, thereby reducing the depression and inflammatory phenotype. Let's take a look at an example of that. So let's look at this article from 2009, Recognition and Management of Vitamin D Deficiency. This article actually confirms some of the conspiracy theories that I'm alluding to, so let's take a look at it. Here they state vitamin D deficiency has been linked to depression and decreased cognitive function. So that's obviously an understatement, because by this time, in 2009, we already had at least 2 clinical trials showing that vitamin D supplementation provided an antidepressant and or mood elevating effect. So I've seen this actually firsthand when I was working in a rheumatology clinic. These doctors who are charging $400 per hour would completely ignore the fact that their patients are vitamin D deficient, but would be happy to prescribe them an antidepressant drug that costs $3,000 per year, or a biologic drug that costs $80,000 to $100,000 per year, when these patients are paying $400 per hour for these consultations. And we had clear laboratory evidence of their nutritional deficiency, and these doctors wouldn't treat the vitamin D deficiency that was right in front of them, which was probably contributing to the pain, depression, and anxiety that these patients had, but they would be happy to prescribe an antidepressant drug that has a black box warning and a price tag of $3,000 per year, or a biologic drug that has a price tag of $80,000 per year. They'd be happy to prescribe that while they ignore the $30 per year vitamin D deficiency that's right in front of them.